Welcome everyone to this session where we're going to introduce NHS Digital's mental health data, including how to access our open data and interpret that data. I'm Kate Croft and I head up a team of analysts working on mental health and community data at NHS Digital. And this is Paul.
Hi everyone, I'm Paul Jennings. I'm an analytical section head working with our psychological therapies data.
So in this session, I'm going to introduce NHS Digital and our data services before moving on to looking at our mental health data sources. Paul will then demonstrate how you can find our aggregated open data and the supporting information that will help you use it. This will be particularly focused on our two of our main mental health data sets, which we collect at record level and then make publicly available after adding useful measures and applying disclosure control methodology. We're really interested in your views and questions, so please comment in the chat as we go through and we'll review all your feedback after the event. If you want to make any comments after this session, please do, and you can do that through our mailbox, which is mh.analysis@nhs.net. First of all, we want to ask you a question. If you could let us know who you are through the chat. If you start your response with A1 and give us your name, your role and your organisation. Thank you. So I'm going to introduce NHS Digital to start with, and our job is to use data and technology to help improve health and social care services. We do that through a number of key functions. These include managing more than 100 active IT services for the NHS and care system. These are vital to the everyday work of almost all clinicians and other professionals in the NHS. For example, NHS Mail, through which 10 million emails are sent every day. We also design and build and procure new digital services and systems. This means that we're often your first point of contact with the NHS. For example, we developed the NHS app, which has become really popular recently, and we now have more than 10 million users of that service. We also collect, process and link data for the health and care system. We develop a number of IT and data standards. They include standards around information governance so that data is health and social care data is securely used. And we are also the cybersecurity partner to the health and care system, which help local organisations keep their systems secure. In terms of the data we use a number of different mechanisms to collect data from a variety of health and social care organisations, including NHS trusts, local authorities and independent sector organisations. This includes data collection through our national record level data sets, our data collections, our clinical audits, and we conduct a number of different surveys to find out more detailed information. This gives us a wide range of both record level and aggregated data about activity, outcomes and people's experience. This all helps us inform policy and monitor and improve care. In terms of then all of that data we make publicly available. So we firstly process and sometimes link the data, and we make that available through our website, through our official statistic publications. For some key data sets, we produce interactive data dashboards. Where we have answered individual requests for data, we make some of that data available through our supplementary information page or through our freedom of information page. In order to help all users, including yourselves, make better use and more intelligent use of data, we do a lot of analysis on data quality, and we make that information available as well. And then if the publicly available data does not suit individuals' needs, we have a data access request service where clinicians, researchers and commissioners can request aggregate record level data in order to do their own analysis to help improve health and social care. In terms of our mental health data, we have a number of different sources. That includes our record level data sets, which are the mental health services data set, improving access to psychological therapies, and our assuring transformation data sets. We have a couple of surveys we do, one on children and young people and another on adult psychiatric morbidity survey, which look at the prevalence of psychological disorders. And then we have another couple of data sets which contain some mental health data. For example, the quality and outcomes framework includes data around depression at GP practice, and our NHS workforce statistics have information about the mental health workforce. We've now got a couple of further questions for you. The first one of those, if you could start with A2, is how familiar are you with NHS Digital's mental health data already? And then if you do already use it, if you could let us know how you use that data. So I'm going to move on to Paul now, who's going to talk through our mental health data in a bit more detail.
Thanks, Kate. So I'll begin with the Mental Health Data Hub. So the Mental Health Data Hub is a great place for you to explore interactively all of our various mental health data in one place. So if you access the Mental Health Data Hub landing page through the URL that I'm sharing on the screen now, you will be able to find links to all of our topic-based analyses covering various elements of the data sets that Kate has described already. NHS Digital's publications are easy to reach through our homepage using the search bar. You can simply type the topic of interest into the search. For our official statistics, select the monthly statistics result, which should appear first in the search results. Clicking on this will take you to a landing page for our statistical series, giving you links to the most recently released data as well as past iterations. Similarly, you can find our Iap publications by typing Iap into the search bar. This will take you to another landing page laid out in exactly the same way. Our data are published as government official statistics in a series that is updated monthly. When you view one of our monthly publications, you'll see a screen like this. Our reports are made up of a summary letting you know what the publication is about and any pertinent information related to that reporting period, a set of key facts for the casual user. So here you can see the recovery rate, which I'll reference through this talk. We also release interactive visualizations of our data, which I'll delve into shortly. And we release data in a comma-separated value CSV format to enable reuse of our aggregated data. You'll also find links to subpages that cover more detail about a range of data in the publication. So for example, the Iap releases include sections on activity, waiting time, and outcomes. Our interactive dashboards are a great way to easily access our data and compare services. For example, the psychological therapies dashboard goes into a great level of detail, covering amongst other things patient outcomes. You can view outcomes at national, commissioner and service provider levels. You can even use the drop-down menus to compare providers and commissioners, turning data into insight. Our mental health statistics each have a front page so users can access the data and supporting contextual information in one place. Our Iap front page is accessible through the URL digital.nhs.uk/Iap reports. This will take you to a page containing links to all of our publications, past and present. You'll also find links to supporting documents such as metadata, user guidance, and data quality summaries. You'll find summaries of changes to the methodology used in our statistics over time, and other useful information such as the dataset specification, as well as links to external policy and programme reference material. When you open one of our CSV data files, it looks like this. The structure is static, meaning that you can easily set up your data ingest processes to make use of the data. It's easy to query the data directly by applying a filter through Excel's filtering tool. There are columns for the reporting period start and end dates, the geographic level. We usually present data at national, commissioner and service provider levels, although some of our data will include other breakdowns. We also have organisation codes and names for reference. Each measure is listed on a separate row, and each has a unique reference number, helping you use this in tandem with the metadata to understand all of our published measures. I'll talk about the metadata shortly. The final column shows the statistics themselves. Our publications adhere to data disclosure rules designed to protect patient confidentiality. You can apply filters to easily navigate to the data that you're interested in. So for example here, I'll just filter the data by England level and then look for the count of new referrals to Iap services. And there we are. So each of our statistics series has an accompanying metadata file that explains how the measures are being calculated from the source data. For the mental health services statistics, you'll find a link to the metadata at the bottom of each release, as you can see here. For the Iap statistics, you'll find a link to the metadata on the publication front page. Which you can see here. When you open the metadata file, you'll find it laid out like this. Each row corresponds to a published measure exactly as it appears in the statistics. So for example, here is the count of new referrals received to Iap services. So each measure has a reference number and a plain English description of what the measure means. There's technical information about the source data used in the statistics, as well as any derived fields. And finally, the construction column tells you how the measure is built. The constructions are written in pseudocode so that they are querying language agnostic. Using the count of new referrals as an example, you can see here that we are simply counting the referral.pathway ID where the referral received date was in the reporting period, and with an additional clause to further limit the data. The additional clause here relies on a derived dataset field, and you can use the derivation reference column to find this in the dataset specification. So we're just going to finish with a couple of final questions. Now that we've shown you the mental health statistics that we release and the data sources, is there anything that you want NHS Digital to do differently with our mental health open data? So please start your response with A4. And finally, question 5 is, will you do anything differently as a result of today's session? So please start your response to that question with A5.
Thank you very much, everyone, for listening. And we're now going to move into a Q&A session. Thank you.
Thanks, everyone.